Welcome back to Mass Appeal, everyone. It's Breast Cancer Awareness Month, as you know, and at Cooley Dickinson Hospital in Northampton, they offer a wide range of services to help fight all kinds of cancer. So today we have Dr. Lindsay Rockwell and Beth Neisner, Executive Director of the Cancer Connection. You're both here to talk to us primarily about breast cancer. And I can only imagine, it's happened, in my family, people have been diagnosed with cancer, and that moment of diagnosis is terrifying. But from there, I feel like once you hook up with a good hospital and you start determining your path of care, it all starts to become ever so slightly easier. So let's talk about how you determine that path of care and what goes on after the diagnosis.
Absolutely. So I think that's a very good point, that once you're hooked up to the appropriate people,
it becomes less scary.
It becomes less scary, and the ground becomes more firm that you're walking on. And what we've learned due to the complexity of breast cancer over the last several years, and decades actually, is that it really takes a multidisciplinary team, Seth, to put together an appropriate plan. That can include a medical oncologist, a surgeon, a radiation oncologist. And in this age of tailoring treatment, it also includes thinking about integrative modalities. And that's where my wonderful collaborator and partner, Betsy Neisner, comes in terms of her directorship of the Cancer Connection.
Tell us a little bit about the Cancer Connection, what you do, and how you work in conjunction with local hospitals like Cooley Dickinson.
Well, we provide the sort of integrative therapies that help people cope emotionally with what they're going through, and also relax themselves. I mean, everybody knows that if a child falls down and skins his knee, he's going to run to his mom, not for top medical care, but for a hug. And so you need people who are on your side, who understand what you're going through. So we offer one-to-one guidance, helping people find second opinions if they want, trying to figure out how to talk to their kids about what's happening. We have integrative therapies, Reiki, reflexology, acupuncture, massage, guided imagery, exercise classes, Pilates and yoga and aqua aerobics.
All the things that work in conjunction with good medical care to get people better. Now we're looking at some of these photos, and I think what we're having right now is this acupuncture. Now what does that do for patients?
There's been data showing that acupuncture can improve chemotherapy-induced nausea and vomiting. And there's also data looking at pain control, which is optimized with conventional narcotics as well as acupuncture. So more and more we've learned that acupuncture can really play a role in managing symptoms.
And there's so many things that can play a role. It almost seems like the person's at the center of the care, and then it's like a tire. There's so many spokes and so many different modalities that help someone become well.
Yes.
And we're advancing at such a fast rate towards finding a cure and towards making it easier to get better. Let's talk about some of that new research. What's been up and coming lately in cancer and breast cancer generally?
So in the early 1990s, the National Center for Complementary and Alternative Medicine began having clinical trials, mostly because there was a demand from the people in our country to have more knowledge and to understand what is this role of balancing conventional care with integrative modalities. And what we've learned, especially in breast cancer, is that mindfulness-based stress reduction can improve quality of life, decrease stress, and improve insomnia, as well as menopausal symptoms. Acupuncture can help in pain control, as well as chemotherapy-induced nausea and vomiting. There are other modalities, reflexology, massage, music therapy, all of which have been studied looking at randomized clinical trials, are kind of gold standard to establish evidence-based therapies to really enhance how an individual walks this path.
And I think another thing that these varying modalities do is create a sense of de-stressing, because I can only imagine that stress, well, it might not be able to be quantified, but it makes your life so much harder. I can imagine it would maybe make the cancer more aggressive. You know what I mean? It's just, to be calm is to be happy, especially when you're dealing with something as difficult and as paralyzing as a cancer diagnosis.
And it's not just calmness, it's having some control over how you take care of yourself.
Absolutely.
So that you can't, you feel like you've lost total control when you become part of the cancer medical care system. But with these therapies, you can choose to make yourself daily feel more secure, more rested, more in control.
And you touched on something earlier. When people get a cold or when they scun their knee, they know the course of action. They can feel comfortable that they will get better. But when it comes to a cancer, you don't know. You're relying on other people. So at the Cancer Connection at Cooley Dickinson, you've created a network so that people can feel calm and welcome and comfortable. And we're looking right now at information about the Cancer Connection. They can get in touch with you, and they can also get in touch with you at Cooley Dickinson to set this in order so that people can begin to feel better and feel the ground underneath their feet.
Absolutely. And often what I say to folks when they come in with a new diagnosis is, you know, our job is to create a net to catch them if they feel like they're falling, and to also give them a blueprint so that they can see the map in front of them. And often there's just it's a sigh of relief. It's a sigh of relief that they don't have to do all of that. Part of what we're doing with Mass General is working on collaborating so that we can provide all of this care, and we're also dialoguing with Cancer Connection and the experts at Mass General who have this experience and have done these integrative
Well, it takes a village,
process.
It takes a whole Pioneer Valley, you know, to make someone feel whole again. Thanks for stopping by, and if you want more information on this and any other topic Cooley Dickinson related, their website is cooley-dickinson.org.